Assalamu alaikum. Hello learners, you are welcome to my biology class. In my last class, we basically discussed about vitamin, sources of vitamin, minerals, sources of minerals and function of water and roughage. Today, we will discuss about some vitamin and mineral deficiency disease. At first, goiter is an iodine deficiency disease. Iodine deficiency disease. Goiter, you see, it is basically enlargement of thyroid gland. Enlargement of thyroid gland. Enlargement of thyroid gland. Thyroid gland. Goiter indicates enlargement of thyroid gland, and you know iodine deficiency disease. Goiter basically occurred in the northern region of Bangladesh. The people of northern region of Bangladesh now can you tell me why the goiter occurred in the people of northern region of Bangladesh? Northern region far away from sea, and you know that sea fish and the soil near to the seashore contain iodine. Sea is the great source of iodine. So the people from far away from sea suffer from this disease, that means goiter, more. And you also know the sea is the main source of iodine, and the southern people has less possibility of having goiter. So to prevent, now you can tell me that to prevent goiter, you should take iodine. You should take iodine enriched food. To prevent goiter, you should take iodine enriched food. What are the iodine enriched food? Sea fish, seaweed, sea algae. Sea fish, seaweed and sea algae. This type of food contains iodine. So you learn goiter is iodine deficiency disease, and the people, basically northern people, suffer more from this disease, and southern people has less possibility of having this disease, To prevent goiter, we should take sea fish, seaweed, sea algae, as sea is the great source of iodine. Now, night blindness. Night blindness, in Bengali ratkana. Night blindness is vitamin A deficiency disease. Vitamin A deficiency disease. A patient of night blindness symptoms: not be able to see in dim light, not see in dim light. If people suffer from night blindness, he or she is not able to see in dim light, everything seems to be hazy. Everything seems to be hazy, and in severe state, cornea becomes cloudy. Cornea becomes cloudy. Now, night blindness, look, this patient is not able to see in dim light, everything seems to be hazy, and cornea becomes cloudy in severe state. So what can be done to prevent night blindness? Prevention. Vitamin A enriched food. Take vitamin A enriched food. Vitamin A enriched food. And finally, cornea transplantation in severe state. Cornea transplantation. Cornea transplantation. So, dear student, we should take vitamin A regularly. Now, rickets. Rickets is vitamin D deficiency disease. You know, vitamin D is able to absorb calcium and phosphorus in the intestine. Calcium and phosphorus, the most important element for the formation of bone and teeth. So vitamin D is most important to form bone structure of bone, and our skin, inside the skin, there remains a substance known as cholesterol, and in the presence of sunlight, cholesterol is able to produce vitamin D, but vitamin D is basically lastly produced in the kidney. Finally, vitamin D is produced in the kidney. Look, vitamin D is basically produced in the kidney. Now, symptoms of rickets. Symptoms of rickets. Bones become weak. Bones become weak. Swelling of bone joint. Swelling of bone joint. Bone becomes bent. Bones become bent like bow, and in severe state, in severe state. Thorax, you know thorax, the abdominal cavity, thoracic cavity, the rib cage, including rib cage and sternum form thorax. Thorax become narrower. In the case of children, the vitamin D deficiency disease is known as rickets, but in elder people it is known as osteomalacia. Now the symptoms of rickets: bone becomes weak, swelling of bone joint, bone joint gets swelled, bone becomes bent like bow, and thorax become narrower in severe state. So to prevent rickets, we should take vitamin D enriched food. Now, anemia. Anemia basically iron deficiency disease. Iron deficiency disease. But there are more causes of anemia. Folic acid causes folic acid, vitamin B12, folic acid, vitamin B12, and excessive blood loss due to accident or any kinds of injury. Worm infection, and the pregnant woman during childbirth, giving birth to child, they may suffer from anemia. Now, the main cause, it is iron deficiency disease. It occurs due to the deficiency of folic acid, vitamin B12, excessive blood loss, worm infection, and pregnant women may suffer from anemia during giving birth to child. Now, symptoms of anemia. Symptoms: weakness, number 2, palpitation, number 3, loss of appetite, headache, dark vision, etc. Weakness, palpitation, loss of appetite, headache, palpitation, the dark vision, etc. are the symptoms of anemia. Now, preventive measures. Prevention: take iron enriched food. Warm removing worm destroying medicine, etc. Anemia, you learned anemia is iron deficiency disease, but there are more causes for anemia: folic acid, lacking of folic acid, vitamin B12, excessive blood loss, worm infection. So to prevent anemia, we should take iron enriched food and worm destroying medicine also. Dear students, you learned the deficiency disease, 4 deficiency disease. Firstly, goiter, night blindness, rickets, and anemia. Thank you. Assalamu alaikum.